mayor of Naperville is calling for the removal of mask mandates in Illinois amid an increase in COVID-19 cases in the state. Last week, Mayor Steve Chirico posted on Facebook saying, "Fact, Illinois is the only Midwestern state that currently requires a mask, and yet as of today, we are no better off than the surrounding states." It goes on to say, in my view, based on the CDC information and the minimal, if any, impact of COVID mitigation strategies on actual results, it's time to drop the mask mandate in Illinois. Joining us to explain his stance on the mask mandate in Illinois is Naperville Mayor Steve Chirico. And we're also joined by Dr. Mia Taramina, an infectious disease specialist with Dooley Health and Care, formerly known as DuPage Medical Group. Thanks to both of you for joining us. So, Mayor, let's start with you, please. In your social media post, you cite CDC data showing southern states in the U.S. Currently have lower transmission rates. Tell us more on why you think the mask mandate should be lifted in Illinois.
Well, first of all, thanks for having me. I think that what's more interesting is not the southern states, because people can argue that that's a different climate and different types of behaviors that can lead to safer environments, perhaps. But in the Midwestern states, this 9-state region, we're the only state that requires a mask. And really, we are right in the middle in terms of death rate. Illinois has a lower transmission rate than the surrounding states. But we're all in the same grouping. And transmission rates really, surprisingly, aren't a direct link to death rate, which I think I used to believe it was. At least that's what I was told. But it doesn't play out that way.
Could that lower transmission rate not be a reflection of the existing mask mandate?
Yeah, it could be. But I think the ultimate measure is death rate. Look, people get sick, and we understand that masks can help a little bit, but at what cost? And right now, I believe that I don't think the data is supporting, and it's not a huge burden, believe me. I mean, trust me, I'm not beating up the governor on this. I think he's made his best effort to protect the public. But the other 44 states, I don't think are all wrong. I think that Illinois right now is one of the outliers, and we have watched this virus cycle through states with mask mandates and without, in a very similar fashion.
So for viewers' reference, in DuPage County, it's currently experiencing a 3.8% positivity rate. That's up nearly 0.5% in the last 7 days. Illinois' current test positivity rate is around 4.1%. Dr. Taramina, over to you. What is your response to the mayor's argument about lifting the mandate?
I agree with him on the context that we are the only Midwest state at this moment that has a mask mandate in place. I don't think that's going to be the case very long. We're looking at our neighbors in Michigan with a 17% positivity rate over the last week, our neighbors in Minnesota with an 11% positivity rate over the last week. These are not acceptable trends. This very much is beginning a fifth wave of this virus, which can get really out of hand with the upcoming holidays. I want these masks to be done and over with. And I think in some ways, in a stepwise fashion, we're going to see that in the weeks and months to come as we progress through booster doses, as we progress through vaccine mandates, as we progress through vaccinating more of our children. But at this moment in time, the trends are not favorable. With a 4.1% state positivity rate, we are approaching that 5.5% positivity rate that originally put us back into the masking in August.
And Dr. Taramina, also sticking with you, which factor should we, are public health officials and the governor considering when they look at when and whether to lift the mask mandate?
So specifically looking for getting out of this substantial to high transmission rate category. And we've been sitting there for quite a long time. We got down nice and low in September and things were looking like they were making good strides. But here we are again with October and November bringing us indoors and bringing us closer together. And we are seeing these cases uptick again. We still only have about a 50% fully vaccinated rate in the state of Illinois. That's not going to be enough. It's not going to achieve what we need statewide in order to get us to a point where we are feeling that herd immunity that's being experienced in some other states at this point with either higher vaccine rates or with a combination of vaccines and recovery, like what we've seen in some of the southern states with so many people being infected with COVID that they're essentially experiencing very low transmission and positivity rates because of a feel of widespread immunity right now.
And Mayor Chirico, last year, members of Naperville's City Council were split on the issue of enforcing mask wearing and then deciding to reject it. Tell us about the approach that the city took and why.
No, I think there was, first of all, it was a very different world at that point. We had no vaccines. The therapeutics weren't as advanced. We did have a lot of stress in our hospital system. And so we were looking for tools. And one of those tools, obviously, was the masks. I think the reason that we split was, and it was a split, it was a 5-4 vote, I believe, was because I think a number of us, including myself, had visited other states where they weren't having as strict of mitigations, and they were having very similar results. And so, from my perspective, it just didn't make sense. And since that time, we have certainly gained a lot of tools. We have come a long way in terms of both vaccines and therapeutics. As of yesterday, actually, our local hospital had 28 ICU patients. Only one was a COVID patient. So, and we are in a period of advanced, accelerated transmissions. And so, from the beginning, we all talked about the whole purpose of trying to flatten that curve was to protect the healthcare system, which I fully support and agree with. Really, the healthcare system was stressed in the first wave, lesser so in the second wave, lesser so in the third wave. Today, for COVID at least, it's just not
COVID
it's not having the same reaction, not
major
having the
stressor on the healthcare system. We've got about 30 seconds left. Sorry to interrupt. I want to get back to Dr. Mia Taramina before we run out of time. What is your advice to people who are pandemic weary about mask wearing and vaccinations and boosters, as we head into the holiday season in the colder months?
Is that question?
It's all about layered mitigation.
Go ahead, Dr. Taramina.
And with layered strategies, we have to include vaccination, masking, social distancing, hand washing, all of the above. And the more of these factors we have at play, the safer we're going to have experiencing over the holidays. If you haven't had your children vaccinated yet, now is the time. We are seeing these numbers tick up, and we want to keep these kids in school. We know that they're not going to have severe illness in most cases, but the prolonged syndromes that some of these kids and adults experience after getting COVID infections is just sort of altering, the sense of normalcy and staying in school and staying at work and getting back to the day-to-day. The masking will fall soon enough. We just have to hold on through these closer winter months and get these numbers back down again.
Okay. Dr. Mia Taramina and Naperville Mayor Steve Chirico, thanks to you both for joining us.
Thanks for having us.
Thank you.